We can get started now because we needed to reconnect with our Zoom audience. Welcome, my name is Anne, and on behalf of our open and affirming community here at First UCC, we're excited to welcome Dr. Todd Nippoldt and his wife, Diane, who joined us for church, and Todd is going to talk to us for a little bit. All of the details are in the bulletin today, but he started the Mayo Clinic Transgender and Intersex Specialty Care Clinic in 2015. So we're excited to have him be here and talk to us for a while. There will be time for questions, and if you have a question, you could raise your hand, and people will be able to hand you a card and a pen. And then at the end, I'll read the questions, and Dr. Nippoldt will answer them. So without further ado, welcome.
Okay, well, thank you very much, Anne, and thank you all for inviting me to speak at your church and for your willingness to learn more about the transgender community. For this presentation, I'm initially going to review our understanding of gender identity, and then I'll discuss the social experiences that transgender people experience in the United States. And then we'll go on to discuss what we do as medical professionals and the community can do as a community to improve the lives of transgender people. Am I blocking this for anybody? Can I stand? You want me to stand somewhere else? Right here? Okay. All right. Okay, that's fine. So this slide shows how many people in the U.S. are transgender, and this is from a survey that was done in 2015, and more recent surveys are similar to this as well. So it's about 0.5% of the population is transgender. And as you can see, younger people, a higher percentage report they're transgender. Now, it's unlikely that the human race is changing. It's likely that younger people are more willing to disclose their gender identity. Because fortunately, the younger people are much more open about things, and the older people have lived in a time when the discrimination was really bad and maybe best for them to not disclose who they were. So this is, first off, these are how we understand sex, gender, and sexual orientation. And those are separate entities, and they all move on to influence gender expression. This chart shows how each one of these three things here interacts to influence any one person, and then how they express themselves. So sex, we use that to determine what the chromosomal setup of an individual is, as well as their anatomy at birth. Sexual orientation, of course, is the gender or genders that a person is attracted to. And gender identity is an internal sense of being male, female, or somewhere along the spectrum between the two. And as I mentioned, all of these go into how one manifests their own self through the social norms of either masculine, feminine, or a variant. And with this just same slide, but it just shows that each one of these things is on a spectrum. So from the gender identity side, the binary is man or woman, and then if you're not man or woman, you're non-binary or somewhere in between. And there are lots and lots of terms and areas where any one individual feels they lie. For instance, if someone was more towards the woman side, they may call themselves, I'm non-binary and trans-feminine. And if someone was more towards the male side, but not all the way to male or a man, there's non-binary, and they refer to themselves as trans-masculine. And there are a variety of other terms that people use to describe this. Now, I'm a doctor talking about this, but being transgender or gender nonconforming is not a disease. So when people come to see us, they're not there to treat a disease. Being transgender is just your diversity. It's not, and it also is not a choice. A lot of people think somebody chooses to be one or the other, but it's not. It's just in them who they are, and that's what they just want to live authentically in their intrinsic gender. That's their goal. An analogy that I often use to describe this type of diversity is being left-handed. So if you're left-handed, you're diverse. You're in the minority of people. It's not a choice. You don't choose to be left-handed. That's just the way you are. And all you want to do is use your left hand and not have people get upset about it. And you know, it's the same thing. So, gender dysphoria. And dysphoria means a sense of unease, dissatisfaction, unhappiness that occurs in some individuals, not everyone, but in some individuals due to society. If there's discrimination in the society, if there's stigmatization of the people, and when there's societal stigma, individuals can internalize that and think of themselves along the same ways. And this is one thing that we address when we're counseling people that we see. And then also microaggressions add to dysphoria. And I'll talk more about microaggressions a little later on. So dysphoria develops depending on any one individual's experience and their reaction to that experience in their particular environment. So you can imagine having to face a decision like this. Do I walk into this door and get yelled at, or do I walk into this other door and get beat up? Every time you wanted to use a restroom, every day, and in addition to that, a multitude of other little microaggressions like this. This is an example of a microaggression. I think anyone would have a sense of unease about that. And so that's what we're dealing with. Now, it's also important to know that gender diversity is worldwide, and it goes all the way back into history as far as history's been recorded. And these are just some examples of gender diverse people in different areas around the world. In Samoa, they're referred to as Fa'afafine, and in the Native American culture, Two-Spirit people. In India, there's a group of transgender and gender diverse individuals that are called Hijra. And in some cultures, they're not discriminated against. In fact, they may have special roles in their society, and often they're held in high esteem. Particularly, an example is with the Two-Spirit people. It was felt that they had extra powers because they had the spirits of both male men and women in them, and they often were spiritual leaders. And then in the US, we don't really have a spot for them, but they end up getting discriminated against, even to the extent of violence. So this is a big chart with a lot of data on it, but it's, again, from this survey in 2015, which was actually repeated in 2022, but it's not fully published. They did release some preliminary data, which I'll mention. But so you see in one column is the experience. This next column is the percent of people who are transgender who've experienced that. And then the next column is the rate in the US population and how much higher it is than in red for the transgender versus the general population. So nearly 30% of transgender people in this survey live in poverty, and that is 2 times higher than the general population. Unemployment is 3 times higher than the general population. Being unhoused is very high at 30% as well. Drug use and sexually transmitted infections are higher in the trans population. And sexual assault is really dramatic. 47% of transgender people have experienced a sexual assault at some time in their life. And if you ask them what happened in the past year, 10% will have experienced a sexual assault over the past year. And this is 37 times higher than the general population. School is not a haven. Verbal abuse in over half of transgender school children describe verbal abuse, physical abuse in a quarter of the children in schools. Sexual assaults at 13%, again, in schools. It's amazing. And not surprisingly, a lot of transgender people leave school. And you can just about pick anything, access to health care, any social thing, and it's not only worse in transgender people, it's usually markedly worse. Now, when I saw that they just published this preliminary data from the 2022 study, I wanted to see, because I was thinking that, oh, this stuff will get better. Past 10 years, there's been so much more awareness of this, people are going to be better. But I was disappointed. The only reported things that they had were the number that live in poverty, and then at 2022, it's up to 34%, and 18% unemployment. So it's no better. And of course, suicide is a major problem for transgender people. Just for comparison's sake, again, in the US population, about 5% of people will have attempted suicide at some time in their life. And it's higher in certain individuals. In the lesbian, gay, and bisexual community, it's 2 to 4 times higher, 10 to 20%. And in the lesbian, gay, bisexual youth, it's in that same range at 23%. Who have attempted a suicide in the past year. And for transgender people and adults, it's up to 43%. And many other studies show it higher, to over 50% in some studies, which is remarkable and very unacceptable, of course. So we as medical providers, what we do, our quote treatment, is to relieve the dysphoria. And there's several ways to do that. There's counseling, which centers on self-acceptance and self-affirmation. Social transitioning relieves a lot of distress for many people. And then we have gender-affirming hormonal therapy and gender-affirming surgical procedures. Just to demonstrate the power of easy interventions is a patient of mine that I had, a 44-year-old person, and the only intervention that we had done was counseling and education. This person was really unaware of the transgender state. This was a patient that I saw early on in our practice. And so they said that the thoughts that they've had and the feelings that they've had since childhood, they realized after counseling that these thoughts were not what he called crazy. And they were, and that they weren't, he was not the only person in the world who was feeling this way. And with that realization, he told me that this was the first time in his life that he had felt content. And that was nice to hear because of our intervention, but awful sad because a 44-year-old person who has not been content, it's an unfortunate situation. So gender-affirming hormonal therapy is basically giving female hormones to trans women. The term trans women is the terminology is your sex assigned at birth and then what your gender identity is. And if you're a cis person, in other words, not transgender, your sex is like me, my sex assigned at birth was male, and I identify as a man. And so I would be considered a cis man. Person assigned male sex at birth but identifies as female would be a trans woman, and a person assigned female sex at birth but gender identity is that of a man is called a trans man. So let's see here. The other thing I wanted to say about this too on this slide is there's a misconception that if you're transgender, you've had surgery. And that is really not the case. And in fact, so a trans woman, the percentage of trans women who have had breast augmentation is about 10%, and about 10% of those women, trans women, have had genital surgery. So a huge minority of people have had surgeries. On the trans man side, the top surgery or breast reduction, about 30% of trans men have had that, but the genital procedures, only 1% have had that. And there's lots of reasons for that: availability, risk, cost, all that sort of thing. But there, even when you ask them, is this something you'd want someday, a high percentage just don't need it. If they're, well, all that they're looking for is to relieve their dysphoria. And if they can do that with just counseling, then you're done. You know, that's all that's needed. You don't have to go through all of that because you're not treating anything that's bad. What you're treating is to get the person to feel accepted and feel good about themselves. Where did my thing go? So, does what we do as medical providers work? And it does. There's multiple studies with thousands of patients over multiple countries and over the past 20 years that have fairly consistently shown that hormone and or surgical therapy reduces depression, anxiety, psychological distress, and suicide thoughts and attempts. And it increases social functioning, sexual function, and quality of life. And when asked, has this intervention that you've had, has hormonal intervention, has that increased your satisfaction with life? 98% of transgender people say yes. And you ask, after you've had surgery, has this increased your satisfaction with life? And 97% say that. So it's very helpful. And the regret rate after surgical procedures, some people say, oh, everybody regrets it, and you know, it's consistently less than 1% of people after surgery regret having it. And again, there's reasons for that that may not just be, you know, oh, I realized that I wasn't a trans woman or whatever. You know, it's just, if you have surgical complications, it might not have been worth it for the person. In any event. Okay, I'm sorry. Yeah. Okay. Now, this is one of my favorite slides because this shows an intervention that has no risk and does not cost anything, and that's just parental or family support of a transgender person. And when you, what is shown here then is there's three sets of bars. One are depressive symptoms, considered suicide in the past year, and attempted suicide in the past year. And the dark blue bars are those transgender individuals whose parents are very supportive. The light blue are transgender individuals whose parents are somewhat or not at all supportive. And you can see the profound improvements that are present just in a supportive family. Depressive symptoms are a third of what they are in a non-supportive family. Suicide attempts are in half, and there's this tremendous decrease in suicide attempts just because the family's supportive. And there's nothing that I do as a medical provider with medicines or surgeries that's going to have an impact anywhere near this. And again, no cost, no risk. So that brings us to being an ally. And that was one of the questions that the committee had, what I could suggest for your congregation to be supportive of the transgender community. And just seeing here today, you're well along the way. I mean, you're a very inclusive community. But I think one of the most important things is if you don't remember anything, just interact with somebody the way you would with anybody else. You don't have to make anything up about any differences. Just they're here, they're there, they you know, they don't need something from you unless they ask for it. You know, that's what should underlie all of this. And again, just normalize your relationship. Make it a normal thing. It's not anything going out of the ordinary to accept someone. People's names are very important. Most people change their name, not all, but many do. And you need to respect that. And like a microaggression would be using a person's pre-transition name. That can trigger problems in a lot of transgender people. And again, respect the term that any one individual uses to describe their gender. What they're feeling is what they feel, and you're not going to change that, or there's no need to put it in some other category. And also, you know, you have to respect their preference if they want to disclose their transgender status or not. And, you know, you may think, oh, if everybody knew, then, you know, we could avoid some of these things that might do it. But, you know, let the individual make that decision. And because unfortunately in society, in some situations, it's actually dangerous to be out as transgender. And of course, their privacy in another manner. Pronouns is a big issue as well. And again, using the wrong pronouns for a trans woman who was, you know, before transition was assigned male at birth, you know, referring to he. I actually did that by mistake when I was telling that story about the guy who was not content because he was a trans woman, and I just did it again. I called him a guy. So it happens, you know. I mean, I do this for a living, and it happens. And what you do in that situation when you make that mistake is you just apologize sincerely and then move on. You know, if pronouns are an issue, you can just, you know, listen to someone who may know the person better, maybe using their correct pronouns. And if you don't know, you just ask, because asking is not a problem if you sincerely ask. And one way to also ask is to introduce yourself using your own pronouns. And then when the person would be prompted to tell you theirs when they respond. Avoid assumptions and don't ask unprompted questions regarding their hormonal use, surgical procedures, sexual orientation. All those are really none of your business. You wouldn't ask, you know, turn to the guy next to you or the woman next to you and ask them that in a situation at church, you know, so don't bring it up. And as an organization, I think you're well along the way of making inclusion just routine. Gender-neutral terms can be used in meetings, on forms and titles. And if you need to collect gender and sex information, do that only when it's really necessary. And I saw that you have available all gender restrooms or have single restrooms available as well. There's other things as well. Okay. And then be aware of and try to avoid microaggressions. And so microaggressions are defined as verbal, behavioral, or environmental slights that are expressed toward a person in a marginalized group. And a couple examples are just having male or female as an option for sex on a form. Or a lot of my patients have told me that one thing that is an aggression for them is if they're on the phone and they have a deep voice, but they're a trans woman, they're called sir, or of a higher voice, a trans man with a higher voice is called ma'am, that type of thing. That's what we mean by sort of these environmental microaggressions. And then comments can be like microaggressions as well. Even though you may have intended these to be positive or supportive, it often doesn't help. So you want to avoid things like talking about their appearance. You look so pretty. I would have never guessed that you were trans. You look just like a real woman. Be thankful you don't have periods. It's annoying. You know, they don't want to hear that. Ask about surgeries. We talked about avoiding that. Telling them they're brave. And or saying, oh, it's cool to be a trans friend. Well, that's about you. It's not about them. So it's just not necessary. And again, learning, I think, about things is the most important thing, because this is not an easy topic. You know, even in medicine, when I went through medical school, residency training, fellowship training, this was not discussed at all, zero. And up until about 10 years ago, it still was not in medical school curriculums. It's changed a lot in the past several years. So learn about it, have an open mind. As I mentioned, the person will speak for themselves. Don't give them something just because you have it and you think that it would help. You know, if they don't need it, they don't want it, let them be. There's a lot of good information on the web through the GLAAD organization, the Human Rights Campaign, the Trevor Project, which is more aligned to youth. And there are many documentaries. I just put one up here. It's a very old one, but it's very good. It's a National Geographic documentary called Gender Revolution, A Journey with Katie Couric. You can find that online and on YouTube and in some streaming services. The other thing to realize about allyship is that it's a sustained and persistent pattern of action. That it's not just a one-time interaction, it's over time and persistent and goes beyond the individual. It's, you know, again, and you guys are doing this too, you know, talking about being involved in the community and to improve the community and improve the, with the laws and everything and the healthcare access and things like that. And once again, if you make a mistake along any ways, just apologize and move on. And finally, again, just interact as you would with anyone. And that is what I have to present, and I'm glad to take any questions. Yes.
Talk just a little bit about how your practice started and how did the institution invite you, or did you have to?
The way it happened is that. Oh yes, I'm sorry. The question was to talk a little bit about my experience in bringing the transgender care at the Mayo Clinic, what we went through, and was it invited to do this, or how did I go about doing it? There was actually an institutional committee that was put together to look at health care deficiencies that Mayo had in the LGBT intersex community. And one of the recommendations from that was, because we weren't seeing transgender people at all, hardly. And so one of the recommendations of that committee was to develop, excuse me, a multidisciplinary clinic in which all the needs of transgender people could be done, you know, under one roof and so myself and a psychiatrist that we worked with who had a lot of experience with transgender people started putting this together. It wasn't easy, you know. Unfortunately, you know, you think, okay, Mayo says do that, okay, and so you say, okay, I'll do it, but they don't give you any time to do it and they don't give any funds to do it. So it's a lot of work, and it's a lot of education, actually, overcoming people saying, we don't want to do this. Why would you want to do that? Well, I've heard that so much when I was starting out. And, but eventually there was, it was amazing. There were people that were experts in this from the behavioral health side that were at Mayo already, but working in different areas. So you find them and get them involved, and then that just really helps. Even people who did not have expertise had a huge interest, and those people would get involved and help things too. So that's how we did it. And I had to sort of teach myself the hormonal aspects of this, which is actually pretty easy. We do it all the time, except we give female hormones to females typically, and otherwise, you know, but it's the same aspects almost. And then to really put it together where the behavioral health, the medical management, and the surgical management is all together, and we talk to each other. I went around the country to look at other transgender places, and at that time, 2014, 2015, there really wasn't anything that was truly integrated. You know, it's easy at Mayo because that's what Mayo is. It's an integrated practice. And, you know, it was easier to do it in that situation, but we really made sure it's integrated. When we started out, because everybody was learning, we would have a conference about every patient before we started hormonal therapy. And we'd have a conference about every patient before we started any surgical therapy. And once we learned about it and we got more busy and more people, you know, we just made sure that the behavioral health and the medical provider interacted between themselves to make the decision on when to start hormonal therapy. And we still discuss all surgeries with our whole group before we move on to a surgical procedure. And that I think really makes sure that regret thing stays low, because the person has to be ready for it. They have to know what they're getting into, and we make sure that occurs. Right. 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 Yeah. Yeah, so the question regards the desire to have children and the society's inability to let that happen in trans youth. And I think the most important thing that you mentioned, but it often does not occur for a variety of reasons, is prior to any medical or surgical intervention, you have to ask about fertility preservation. And that has advanced remarkably over on preserving eggs. As sperm's easy, and it's been doing that forever. You know, that's easy and still the same process. But with eggs, the ability to preserve eggs for future use is really advanced. But again, it's not a cheap undertaking. And your other question regarding all of that was, are there support groups available specifically for that? What I would suggest is there's an organization called WPATH, the World Professional Association for Transgender Health. So this has been an organization of, it's all fields of people who take care of transgender people. And they have excellent resources, and that's where I would start if someone was asking me to find support for someone along with any one particular issue. So World Professional Association of Transgender Health, WPATH. Yes. Yeah, well, the other thing that's happened, the question is, a lot of this stuff costs money and maybe cost prohibitive. Are there resources for the cost of any of these interventions? Private insurance has markedly improved over the past 10 years. Actually, it was around 2015 and, as well, where, I'm sorry, where Medicare used to not cover transgender procedures. But in 2015, they changed that. So it did. And with that, private insurance companies gradually started doing it more and more and more. So that's one benefit. If you have insurance or Medicare, it's going to be covered, but it's still, you know, if you have to still pay 20%, that's a lot of money in some of these situations. In Minnesota, Medicaid is available, and in my experience, the individuals who were on Medicaid, they had the very best medical coverage for all of this. It was better than if you're a Mayo employee. They covered things, and it was, so Minnesota's done great from that standpoint. Yeah, I'm trying to think about other, oh, thank you. Again, when people are in situations like that, they work with our social workers to try and find stuff. And there's nothing dramatic that I can say. And once again, that's another area where you may look at either the websites for WPATH. There's also what's called US Path, so that's separate from the world, but they may be more specific for that situation in the US. Yes?
I'm wondering about political climate in Minnesota. I'm grateful to live in Minnesota, by the way. Political climate, would you have impact on that in legislation policies? And if there are people coming from other states that are coming to Minnesota because of their state policies?
So the question is the political environment in Minnesota and other states, and did we help influence Minnesota's coverage? From not directly, however, there is a group that has been present for a long time. The University of Minnesota has a very good program in human sexuality, it's called, and that's where the initial behavioral health people that we had, they had this, and they are excellent, and they have been politically active through community organizations to help influence legislation for many years, and we certainly supported that, but we didn't initiate that. And the question regarding people coming to Minnesota for care, yeah, that was going on since we started. You know, a lot of people would actually move to Minnesota because they could get coverage here. And I've been retired for 3 years, so that was before these states started passing transgender care bans. But when I talk to my colleagues, they are exceedingly busy because people from Iowa, we always had people from Iowa, South Dakota, Wisconsin, just like we did for, you know, any type of thing, cardiology or whatever, people who come there. But it's much more now since not only would they choose to come to Minnesota or Mayo Clinic because they think it's a better comprehensive approach or whatever, it's against the law where they're living now. So it's very, very busy. Yes.
I just want to make sure I understood what you just said a few minutes ago. Did you say that medical insurance in Minnesota does cover trans care?
The Medicaid, yes. So that's the government insurance for low-income people, and children is Medicaid. Medicare is for old people. Medicaid's for low-income people. And so, you know, if you're low-income, you can basically get health insurance in Minnesota through Medicaid.
What about regular health insurance if you're not low?
Then that, as I mentioned, those private insurances have really come a long way in the last several years about covering transgender procedures, both the medical procedures and surgical procedures. They do, yeah. Yes.
When you're in a clinic setting and the parents are there with a child and patient, what's the number one concern the parents express to you, or the most common concern, and how do you answer it?
So the question is, in an individual where you're seeing a child and come with their parents, you're wondering what the major concern the parents would have and ask us about and how we address it. So I think when a parent brings a child in, right there, you're already on first base, because they wouldn't be there if they were totally non-supportive. They would, and believe me, I've seen a lot of people who are 18 years old and say, I couldn't wait until I turned 18, I didn't have to go through my parents anymore, because when I told them I was transgender, they kicked me out of the house. You know, so that occurs. And so if someone is coming with their child, it's a good sign. And with their main concern is this true? You know, is this true? Is this person, my little child, you know, truly a girl, even though it's a male body? And then they also don't want anything bad to happen. And one of the things that helps us decide if every child goes through gender discovery. You know, they play with dolls. A boy might play with dolls for a while, girl trucks, you know, that's just normal. But if someone is truly transgender and a child, a pediatric endocrinologist that I know told me that they are insistent. They don't say, I want to be a girl. They say, I am a girl. They're persistent. It's not a phase. It doesn't come and go and run away. And they're consistent. It's the same thing. So if those things are present, you're pretty sure that this is truly a person who has a different identity than their body. Yes.
Question about the distinction between being comfortable in society and being comfortable in your own body. I mean, our society does a lot to make people uncomfortable with their body, regardless of whether they're trans.
Right.
We have all this stuff, this huge plastic surgery industry, and all the rest of this about people somehow conforming their body to something. But I wonder in the trans world if it's truly that people are uncomfortable with the body they have, or if they're uncomfortable with what other people think.
Yeah. So the question is, is a transgender person uncomfortable themselves with their body as opposed to just being in society with the wrong body? And I think the answer is yes, they are uncomfortable within themselves. You know, so even in the most supportive family, a person may still want to take hormonal therapy, so they feel more like their identity. And we know that because in the past, it was always thought that, oh, you have to stop hormones before you do surgery, and that was a huge traumatic thing for patients. We studied that and found out that it's really not necessary to do that. So, when somebody is on hormonal therapy and you take it away, they're missing something. So they do feel that way internally. Yes.
You spoke about microaggressions, and of course there are larger aggressions as well. As an ally, if you observe this happening, is it wise to intervene? Does it help? Have you learned from your patients that it would help them if third party intervenes, or are you making it worse?
So the question is regarding aggressions or microaggressions, and if you observe that occurring, should you as an ally intervene, or would that just make the situation worse? I think it's okay to call it out. I think that I don't think that most people would feel that that is just making the situation worse from the transgender person's side. So I think that it's okay to do that. Okay. Well, thank you
So-
very much.
Thank you. I think we should give a round of applause.
And thank you, Ann, and thank you, Sue. Oh, yes, and then
Yeah, we have a handout.
this is a handout about being an ally. A lot of the stuff I talked about in there, but it's always nice to have that. This is off of the GLAAD website.
Go enjoy the sunshine.